Hello, everyone. My name is Jason Long. I'm the general manager of Cantata Health's Net Solutions division. And today we're going to be talking to Leroy Bowen, our sales extraordinaire and director of our sales department, who is also a certified professional in healthcare technologies, master's of science in information security, a network design and administration professional, and an advanced practice nurse in long-term care for the last 36 years. And Leroy has a lot to say about how you should treat your nurses. So Leroy, starting off, tell me about the financial assistance. Actually, tell me about the problem. Tell me what's going on in healthcare right now. What's going on in long-term care with people having a hard time holding on to nurses, CNAs, et cetera right now?
Right. Now, Jason, many nursing homes and assisted living facilities were short-staffed before the coronavirus pandemic even hit. Now with COVID-19, it's even harder to recruit and retain nurses needed to care for those nurses and basically stop the infection from spreading. Because of the nursing shortage and the low patient ratio to nurses, when nurses and nurses' aides are stretched thin, they end up cutting corners, which ends up to being a bad outcome for not only the residents, but for the facility. And then you have the unexpected patient surges that leaves facilities understaffed even more, and the managers are scrambling to ensure appropriate coverage. Hiring CNAs and getting licensed nurses in the door is just half the battle. Keeping them there is the second one.
Okay. So I hear that right now there's some financial assistance available in certain states. Can you tell me a little bit about that?
Correct. So currently today, CMS has a waiver out for facilities to help reduce the strain for the nursing and the nursing shortages and the staffing requirements for long-term care. States like Massachusetts and Colorado have launched websites to basically match job seekers up with open long-term and residential care positions that are open in those facilities. For example, Massachusetts is providing a $1,000 bonus for those nurses or CNAs who stay on for the job for a month. Arkansas recently boosted their pay for nurses and other direct care workers through the end of May. Illinois is one of the other states that are letting facilities hire nurses with an out-of-state license, or if they recently expired credential, or allowing them to temporarily hire unskilled workers to basically help and feed and clothe residents. There are services out there that you need to go searching for, but a good start is to just ask the state of California, or go to the state, or go to your state's website, like the state of California, and basically look that up. You do have to do a little bit of research, but there is financial and assistance out there for these facilities.
Okay, fantastic. Do you know off the top of your head if there is a central website that maintains all that information right now?
Currently, there isn't. Each state is independent of themselves. CMS is trying to show some guidance, and the federal government, and especially the Senate and the Congress, is trying to step in and pass some laws to help with the staffing issues that our long-term care and nursing facilities are having. But it's not just so much as hiring people. You also got to focus on retaining what you already have.
Yeah. So I'll tell you what. When let's see if we can get a list of all these centralized on the Cantata website. I'll talk to some of our people and see if we can put that together for everybody. So
that would help.
In addition to financial assistance, though, there's some other things that we talked about that a lot of places are doing or places could be doing. Do you want to tell me about a few of those things?
Absolutely. Sometimes it takes thinking out of the box, and staffing retention is most facilities' number one priority. Your CNAs are more often than not, working more than one job. Allowing them to flex schedule is very important today. It's whether if you're a small facility or a large enterprise company. Offering incentives to flex schedules, so like 4 hours on one shift and 4 hours on another, or being able to let the staff have input in their scheduled hours also helps benefit. So it gives them a sense of control over how they work, when they work. Another big one is actually establishing a mentoring program. This is important. When you hire a CNA, normally you go through the new hire process, they sit down with the DSD, and then they're thrown on the floor with like a pack of wolves, and they go right at it. One facility I know actually started a mentoring program They identified a very powerful, knowledgeable CNA. They paid her an extra 50 cents to $1 an hour. And her primary goal is to guide new CNAs through the onboarding process, work with her directly for a week, and then release her to the floor. They found that when they have a mentor to go to, when they're having a problem, or if there's somebody that they can go to for assistance, they're more apt to retain that CNA. Same thing with licensed nurses. Having a mentor work with licensed nurses, just like they do in the acute care realm, for a week or two to make sure that they have all of the little fine points down and there's no problems before releasing them to the floor, actually has a 50% more retention rate possibility than just hiring the person and putting on straight for work.
Oh, wow. Okay. I didn't realize it was so high.
It's very high.
If I was going to go look for resources on this or put together my own mentorship program, are there some online resources I could go to, or do you think if not, is there a way that maybe we at Cantata can go and find that person that you're referencing and talk to them about putting together some stuff?
You can actually go to the offer or the OIG. They have some resources out there for starting mentorships for CNAs, licensed nurses, as well as managerial staff. Some facilities have reached out to the regional ROP and community resources, and they have helped design mentorship. It actually starts right there at the CNA or the nursing school in your neighborhood. Being able to offer educational, ongoing in-servicing, additional training through your ROPs, for example, is something that people don't think about. Opening up your doors for volunteerism, not so much as it is with COVID-19 today, but when this is resolved, you may want to take a look at that. Involve your staff in decision making. Invite them to become mentors. Pay them a few extra 50 cents to $1 an hour. Across all 3 shifts if you have the ability to do so. And I guarantee you will retain your nurses.
Fantastic. All right. And then for involving in decision making, so we had 3 major things I heard. 4. We had the financial assistance, establishing mentoring, involve in decision making, and flexible work schedules. For the decision making, involving people in decision making, what are some methods for doing that?
One of the primary methods in long-term care today is to involve your nursing staff into your QI programs. This is critical. Once you assign or ask them to be part of that decision-making process, whether it's QA, QI, inviting them to meetings, they start to take ownership. Once your staff starts to take ownership, they start taking interest. The more interest the staff have, the more less likely they are to leave.
Perfect. So do you know where I could go for resources on like how to run those meetings? Do we have anything like that? Like what is the step-by-step process of getting them involved? Because I think that's really like the actionable thing that I would want to know.
There is a 12-step process available on the CMS website in regards to your QAPI program that actually addresses adding staff members as part of the decision-making process. Which you go to CMS website, just type in QAPI resources, and there are a ton of items that the facilities can download and use that actually address not only staff management and maintenance, but QI inclusion.
Perfect. Oh, that's so good. And we'll definitely put a link to that in the associated blog article with this video. And then I think the last thing we've got is flexible work schedules. So tell me a little bit more about that.
Everybody's used to what we call the traditional work schedule, 4 on, 2 off, or 3 on, 4 off if they're part-time. Nursing homes that offer flexible or non-traditional schedules to the employees, that allows facility staff to attend to personal matters, allowing flexible schedules to staff who pursue advanced degrees, such as registered nursing. The most important thing is understanding how they work. For example, if you offer or operate 2 12-hour shifts for your nursing staff, you may want to instead address a typical 3 8-hour shift. Workers who come in from 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. or allow them to switch out. In other facilities, for example, they work 2 16-hour shifts on the weekend, and then they pay them for a 40-hour week. If you do operate 12 hours, or you can have 2 CNAs for care, once again, being able to what we call flex staff is also going to be dependent upon your current census and your current staff load. You're going to have to get creative, but if you move away from non-traditional, you will find that the staff will actually come to bear and help you with the scheduling. Once again, get them involved with their scheduling if you don't do so today, and offer those flex opportunities. CNAs, like I said in the beginning, they often have and work 2 jobs. If you give them the opportunities, for example, to come in the morning and work 4 hours, and then come back in the evening shift or come in a night shift and work that other 4 hours, where they can go to their other job, that allows them to work at those extra days or have time off for family in the afternoons if they need it. And that's critical.
Yeah, that is so important. Wow, this has been fantastic. This has been really, really good. Thank you so much. Did you have any other final pieces before we wrap this one up?
That's all I had for today. But feel free to reach out to me and we can discuss this topic again if needed.
Perfect. We have so many topics to discuss. So if we can, we'll circle back around to it. And if not, then more than likely we'll move on and keep helping people out however we can. So thank you so much, Leroy. You're so amazing. Everybody really appreciates this. And I'll talk to you soon.
Yes, sir.